Hormone therapy. Nothing has been debated quite so much. This debate's been going on endlessly. There was a time in the 70s they thought estrogen increased breast cancer. That has been very much proved to be not the case. That is the big fear. That's in the media, and it's all negative. Studies in 2004, 2007, 2009, 2011, and 2012 significantly lower observed incidence in breast cancer in women on Premarin, the horse urine estrogen, 33% less. Stanford just completed a big study showing an increase in breast cancer in the placebo group. But did they call the Today Show? No. Ticks me off. There has never been a significant increase shown in breast cancer. CDC's been keeping records since the 1900s. There has not been a significant increase. We started using hormones like crazy in the 60s, 70s, 80s. You'd think if it was related, there'd be a parallel increase. There has not been. I call that my common sense statistic. So, estrogen increases your HDL and decreases your LDL. Keeps your blood vessels slippery. Lowers the total cholesterol. Direct vasodilating effect, that is the thing that causes hot flashes, so when you don't have that, your vessels go on, off. It also does not let you deposit things on your blood vessels. It decreases cardiovascular disease by 76%. You were meant to have hormones. You were wired for them since the age of 12. It keeps you healthy. Estrogen increases your vitamin D conversion and decreases bone resorption. Better than any of the bisphosphonates by far, and there's no incidence of jaw fracture, which by the way is very, very low, and other breaks. Huge decrease in fractures. Quality of life. Sleep improves. You sleep all night, you don't wake up. Without estrogen, you tend to wake up multiple times and you don't go into deep REM sleep. So then the next day you feel tired, you don't feel good. The libido and the vagina come back. You remember where you parked that car. Save money on air conditioning. Bones stay strong, palpitations stop. You look like Suzanne Summers, hopefully. And your family and coworkers can actually approach you. 60 years show little or no association. Use of hormones at the time of a breast cancer diagnosis decreases the risk of death because you find the cancer earlier, not because it feeds the cancer, but because you develop an inflammatory response around the lump. People on hormones tend to find their lumps when they're still in the breast before they spread. Alcohol consumption and obesity are a far greater risk. And the media just plays the negative card over and over. Does estrogen cause breast cancer? Everybody buys that magazine, but they never come out and really say anything. This is from Consumer Reports. To balance what may be a negligible increase versus a huge proven life-saving effect on heart disease, osteoporosis, and Alzheimer's. Women who use estrogen live longer than those who do not. Here's a lovely slide. I finally figured out how to get it on my PowerPoint presentation, so I'm pretty pleased with myself today. There you go. The estrogen folks, they do better. Look at the non-users. Why are only 10 to 15% on estrogen? Scary. I have multiple doctors, even in my own specialty, that, well, you should probably stop that stuff. I have Medicare sending people notes saying, you should get off those hormones. They don't want to pay for them, by the way, but they pay for Viagra. Makes you nutty.